Hello and welcome to a revision talk-through video from me, the history tutor. And in this video, we're going to be revising medieval and Renaissance public health. Okay, so the purpose of this video is to watch it a few times and listen to me talking through all the key facts about medieval and Renaissance public health to prepare you for your exam. Then have a look at my revision guide and practice some of the questions. Look at my other revision videos where I'm talking through how to complete answers to a top level and talking through exam question skills. Okay, so now over to the key content. Okay, so let's firstly talk about medieval public health. And obviously, one of the key things about public health should be government action. So there was some government action in the medieval time. You could talk about this factor with the introduction of some laws about miasma. So in the 1300s, laws were brought in to control waste. So the banning of spilling of animal blood in towns and fines about emptying chain pots in the streets. We've got the Black Death. The King Edward is instructing people to tidy up the city of London because it smells so bad. You've also got some government action with the development of privies and toilets. So the pantomime famous character Dick Whittington was a real mayor of London. He built a block of privies along the bank of the River Thames to obviously try and tidy up the waste in London. Wealthy people, though, would also take action. So this suggests maybe a negative government, that rich people had to do more than the actual government themselves. They would pay for gong farmers to come and tidy up their privies of all the waste. They would also spend time ensuring that their homes and the areas around their homes were clean and tidy. Governments would often spend money on war rather than some of their public health facilities, and so this led to sewers and other things falling into sort of decay and public health problems increasing. So this meant that obviously by the Black Death, poor public health helped to lead to the 50% death rate of the population. So therefore, again, going back to the actions of the wealthy people had to therefore take actions themselves. So rich people would have their own private privies in their gardens, or like this one, on a castle wall, and the waste would sort of drop out below. Privies often had cesspits underneath them, and rich people would pay the gong farmers to come and empty those cesspits. So gong farmers was quite a wealthy job, because obviously nobody else wanted to empty the cesspits. Again, thinking about the wealthy, they might go to bathhouses to wash. Now, bathhouses are a bit like a sort of ale house. It's a social place, but of course, washing was part of what happened there in that place. And then religion is important. So some of the old Roman ideas about public health remained important in monasteries and in religious places. They might have drains and sewers to take away waste. They might have toilets. They might have hot and healthy food cooked and growing herbs and healthy foods in their gardens. They would also provide care for the sick with infirmaries to help sick people, and this might involve helping the poor who are sick as well. So we think about the significance for question 2, the significance question. Here's our 5 criteria for significance, our list criteria. So the long term, it remained poor quality public health for most of the time, and therefore inspired poor quality public health sort of ranging into the time periods beyond. The government was not really too involved in public health. There were some important actions, important people involved. King Edward III encouraged public health by inspiring a clean-up during the Black Death, and obviously this helped to lead to an idea of miasma taking hold, which obviously would benefit public health in the future. Monasteries were places of better public health, and that would inspire public health in the future, of course, although monasteries were closed down during the Renaissance. So size and scale, with the size and scale of public health was very poor. So it led to huge amounts of deaths. 40–50% of the population died during the Black Death, which suggests the poor quality of public health. Today, we remember mainly the poor conditions and stereotypically that medieval people were dirty and uncivilized and everything was unclean, therefore diseases spread easily. So it suggests poor significance to public health in this time. Short-term government action did start to take hold to some extent and inspires more government action in the Renaissance and beyond. So they started to ban waste in the streets, which obviously, as I said, inspires short-term action later on. Finally, about the medieval time, think about factors of change. So we talked about government, the local government laws, we've got the role of King Edward, inspiring some government action. Governments were also weak. They did not have public health laws. They did not enforce things on the people to ensure they were healthy. They allowed old public health systems to fall into decay. Religion. Monasteries remained a centre of excellence for public health with sewers, clean water, healthy eating, isolation from illnesses, hand washing, all these things. Again, in terms of wealthy people, we've talked about latrines and toilets and that the wealthy could afford some nice things to keep clean, like bathhouses. So clearly thinking about question 3 and comparing maybe the medieval and Renaissance public health, looking for similarities and differences, some things did say to stay the same. So towns were still crowded and dirty in between the medieval and Renaissance times. People still used privies, cesspits, and gong farmers. Monasteries remained much cleaner places until, of course, the Reformation and Henry VIII removes monasteries. So the crowded nature of these towns obviously meant that towns were very crowded, land was very expensive in Tudor times, so overhangs developed, which actually made the situation worse. The streets could be very narrow, and the idea of people being crammed together felt more intense. Also, houses weren't built very well, so many of them were still made out of wood, which was obviously unsafe. And this was, shown by the Great Fire of London, where much city burnt down due to the wood frame buildings. Other ways it stayed the same is belief in miasma. Obviously, we talked about how miasma and bad smells developed in the medieval time. This became more significant as an idea in Renaissance times with the Great Plague. Doctors would wear the full body clothes to hide themselves from the bad air. They would quarantine people in their homes for 40 days to stop the spread of disease, thus suggesting that things were still based around miasma. Government becomes more of a factor of change in the Renaissance times. So this is a bit of a difference. Government was important to some extent in the medieval time with some of these new laws, but government was even more proactive in Renaissance times. So obviously the Great Fire of London, they rebuilt the city without using wooden frames, and wooden frame houses were banned. They had to be built with more homes that were more fire resistant. The government also during the Great Plague, they ensured that houses that were infected were blocked from people entering. They would have a 40-day quarantine, and there was people watching the streets and watching the homes to ensure that quarantines were kept, and also people who had the illness were found and then quarantined. The dead people were recorded, and certificates were drawn up to start monitoring the dead to ensure that there was no contact between those people who were ill and other people. And obviously, they could then find out who they were with and place those people in quarantine as well. So what's the significance of this then? So in the long term, the government starts to interfere more in public health. So it starts to see the end of laissez-faire ideas declining, and obviously this would help in the 1800s, where laissez-faire ideas disappear altogether and government becomes very much involved in people's lives. Also, the Great Fire of London is an important event, and so is the Great Plague, and these inspired change, the end of wooden houses, and as we talked about already, the end of some laissez-faire thinking. Size and scale. So public health still obviously quite poor. There's still a high death rate. Tens of thousands every year were dying of plague and sweating fever. So every summer, the rich people would abandon London to go to their countryside residences because they believed the smell of the city was so bad that diseases were going to kill people. So today, obviously, we still have quarantine, obviously a sort of isolating people from illnesses that are bad, and we've seen that through the COVID-19 epidemic. And then in the short term, in Renaissance public health, government took stronger action during the Tudor era by shutting cities, stopping plays, banning gatherings to improve public health. Think about factors then. So government has become more important as a factor with the Great Plague and the quarantines, the blocking of borders, etc. Government during the Great Fire of London, banning wooden buildings. Wealth is important. So people have started to build homes now for comfort rather than defence. So these beautiful Tudor homes with many fireplaces, thicker walls, lovely tapestries on the walls to keep their homes warm. This is improving people's health. People obviously continue to have access to better food as well as people got wealthier. And you can think about exploration and trade bringing more foods into people's homes. Religion is a bit of a negative. We see the Reformation, and I suppose this is government action as well, sees the end of monasteries. So that help for the poor has now disappeared because monasteries would have provided charity for the poor. So government and the wealthy start to take over. So almshouses start to appear to help poor people, funded by charity or governments. And the 1601 Poor Law comes into effect, which provides workhouses for poor people. And the 1601 Poor Law will remain significant for about 200 years. So finally, let's think about similarities. So we've already pointed out government were quite similar in terms of public health. Okay, so in medieval time they started to take action, banning waste. King Edward ordering tidying up. This becomes more significant as an idea in the Great Plague and the Great Fire of London. Wealth we've seen as important. Wealthy rich individuals could afford privies and cesspits and gong farmers. This improved even more in this time. Grander buildings, comfort, warmth, etc. Religion still dominates, and is still happening as a dominant factor in the early Renaissance, with monasteries helping the poor. Sorry, please allow me to interrupt just for a moment to tell you about some of the other services I offer. So look at my website, historytutor.co.uk, to find out more about history tutoring if you want help directly one-to-one, or if you've got a small group of friends who want help, then look me up. Also, if you want more information about my revision guides, they're available on Amazon. They are packed full of revision notes, all the essential facts, organised into revision cards or simple forms you can just look over again and again to revise. Packed full of videos helping you answer questions. I tutor you through how to answer all the different types of questions. Lots of videos explaining how to do this. Some of them are free on YouTube. Look me up for more videos, but you'll find more and more videos on my revision guides. So take a look. So I hope you found that video useful and you've managed to recap lots of your knowledge. Do watch it a few more times, see if you can embed lots of that knowledge, and also to look out my revision guides packed full of revision cards, and also how to answer questions to a top grade level. And also you'll find a few free videos of me explaining how to answer questions. So look out for them on my YouTube channel. Okay, do subscribe and look out for more videos. Okay, bye bye for now.